Once again, thank you for coming back from that nice break. We are about to start the third session of our conference, looking at views from the field. We'll be hearing from the perspective of various stakeholders. I would like to briefly introduce our distinguished panelists in the order in which they will be presenting to you. First is Mr. Ken Porter, who is the Actuarial and International Benefits Consultant at the American Benefits Council. Next to him is Richard Fiesta, who is the Director of Government and Political Affairs at the Alliance for Retired Americans. To his left is Ms. Maya Rockeymoore, President and CEO of Global Policy Solutions. And finally, Donna Butts, the Executive Director of Generations United. Their full bios, of course, are in your folders. And as always, after their presentations, we will open the floor up to questions, and we look forward to a very lively discussion. Thank you. Now to Mr. Porter.
Thank you. Well, it's a pleasure to be here. Thank you very much for inviting me. As the title suggests, I'm going to give you an employer perspective on Social Security, and employers are in favor of it. I will caveat my comments in that with all that is in the debt reduction and commission reports that impact employers, we have really no specific analysis of the proposals on Social Security in isolation. I think employers are going to be very interested in seeing how everything in aggregate affects them. So the comments I make will be based on discussions we've had with employer and plan sponsors over the last several years, and what I would suspect might be, but I would caution that everything that would be done would be in the context ultimately of where everything is going. And we would not be considering one particular provision over another at this point. I want to spend just a little time on demographic context, economic context, before giving you the perspectives, because the perspectives make a lot more sense when you see the other two things. You've seen demographics, I'm sure. This is a graph that shows the 5-year age groupings of the population as of the 2010 census. Showed 309 million people, of whom 34 million were between the ages of 55 and 64. No surprise, it's a big group of people. They're called baby boomers for a reason. I've included the number of private sector employees for reasons that will become evident in a few minutes, but it's 113 million private sector employees. This would exclude military and government employees. Baby boomers are basically in there, and if you project out and say, where do we go a few years from now, 30 years projection shows a significantly different distribution of people, and for this projection I have used Social Security mortality tables and the 2010 census. All things being considered, if Social Security employment retirement ages stay where they are, you're going to have a contingent of people collecting benefits 30 years from now that's disproportionate to the contingent of people who are employed. That's not a political statement, it's a statement of fact. And I want to remind everybody, since the subject of Moses came up this morning, that after he reached the normal retirement age, he was full-time employed for 55 additional years. Another basic economic reality, it's simple, but it's factual, and sometimes we have to just make the point. You're either part of the solution or you're part of the problem. If you're a worker, you're paying taxes. If you're retired, you're collecting. Now I understand it's possible at an older ages to continue working and pay taxes and also be drawing down. So this is a little bit of an oversimplification, but the bottom line is if somebody retires and leaves the workforce, two things happen. Revenue goes down, expenses go up. So it's a double hit to the system. And up to now, we've enjoyed the situation where we've had a significant number of additional people entering the workforce for every one person entering the retiree group, and therefore things have remained more or less in balance. But as we go through the next few years and the baby boomers retire in droves, we will find that the number of people entering into the payment phase will put a very significant stranglehold on the younger generation, who we absolutely depend on to pay the bills. Now, the interesting statistic of the 309 million people and the 113 million non-government workers. Now, I'm not diminishing at all what government workers do and the pain that they feel when the tax rates go up. But just observe that if the government pays somebody $50,000 and that person pays $5,000 in taxes, they're just returning $5,000 back to the government. The government's real cost is only $45,000. But that $45,000 had to come from somewhere. It didn't come from the employees' taxes, so it had to come from the private sector in one way or another. So everything the government spends on the net income for its workers, plus all the other things that the government pays for, ultimately is either provided by the private sector workers or the employers that they work for in one form or another, with some exceptions. It's a little bit of an overgeneralization, but what I want to do is try to use a metric that puts a handle on the private sector relative to our population, because this is something that the employers are very concerned about. And it's not just Social Security, it's health reform, it's every aspect of our society, it's the debt, it's the trillions of dollars that we have to find money for, it's the triggers on the economic stimulus and who's paying those bills. Ultimately, those bills get paid some way, the majority of them, by the private sector. And as the baby boomers retire, and the workforce perhaps might shrink, and the retired group increases, that number of private sector workers relative to the total population will shrink, and the ratio will get bigger. As we have seen over the last couple of years, the number of employees in the government sectors has gone up relative to the private sector, and so our total society has become more dependent on public sector workers than we have private sectors. Again, the burden of taxes in one form or another increases. The pressure to increase taxes on the private sector has no choice but to go up. The private sector is seeing at every step of the way in the U.S. debate, regardless of what the subject is, pressure to let's tax one way or another the plans, sponsors, the private sector employees. Yes, government employees will get taxed also, and that helps distribute all from the government sector employees. They certainly take a cut in pay, but ultimately to pay off the incremental debt, the incremental workforce with a smaller group of people, the rate of taxes on private sector has no choice but to go up. We look at jobs going overseas. We see, well, why can't companies keep those jobs in the United States? They should. We would love to see that happen. But to the extent that it costs a company that is selling product in New Zealand that they can make in the U.S. or make in Brazil, the company in New Zealand that's buying their product doesn't care if it was made in the U.S. or Brazil. They want it to be on time, on price, and on quality. So the United States, as a community, needs to be more competitive in the world. It's no longer a case where the government versus private sector. We have to treat this whole economy as an economic endeavor to compete in the world. And to keep our jobs in the United States, we've got to make it cost effective for the jobs to be in the United States when the customers are not in the United States in increasing numbers. So I've just put a simple example of 5 million people just kept working. There are 5 million additional people working instead of retired right now. The average cost per person would go down about 10%. Well, that's not a surprise, it's simple arithmetic, but it's important when you get to the question of should the retirement age be increased. It's critical if we're going to stay in balance that as the population increases, we encourage people to stay employed for a little longer. So I've mentioned these things: health reform, economic shift toward government jobs, economic stimulus, expanding deficits, and the state and municipal pension crises. Where's the money going to come from to pay for all these municipal pensions? Well, it's not going to come from the state coffers. It's got to come from taxing somebody. And ultimately, that's another pressure on plan sponsors, another reason for plan sponsors and companies to maybe consider creating jobs someplace other than the United States. All these pressures coming to bear at one time. Now we're talking about Social Security reform. How are we going to reform Social Security? You cannot talk about Social Security taxation in a vacuum. It is all, has to be in consideration of the global economy and everything else that's going on in the United States. We need people to stay longer. We need social policies that encourage people to stay and facilitate people to stay in the workforce productively. We need an employment shift toward the private sector. We need to establish a comprehensive national retirement income policy. We have none. If we had, we would have a better set of rules, but we have a mishmash of rules created by solving every little problem from day 1 to day 2 to day 3 without a context to look back for. We need a compass that we can look back at and say, this is our policy, and we want rules that fit that policy. I'm not saying what the policy is, it just would be good if we had one. So our guiding principle is that if there needs to be a solution to Social Security, the problem is system-wide, and the solutions need to be system-wide. Plan sponsors typically will not favor a solution that is applied only to a part of the economy. It has to be broad-based. So we generally would support, I believe, universal coverage. I've not heard employers say anything other than that. Employers are very strongly supportive of Social Security being an income source and not a source of cash, of lump sum cash, although there might be some willingness to say that there might be some room for a cash balance account in Social Security if that were to be suggested at some point, but employers would generally not be in favor of eliminating an income source, a steady income source for Americans. We need to do something with the retirement age, perhaps increase it now and then actuarially increase it with the mortality tables so that we move forward. We need an integrated context for reform, not just in Social Security, but all of our tax base. We need something that's going to be sustainable for 75 years, and we can figure out what that's going to be. As standalone proposals, you could see plan sponsors not being in favor of means testing, higher wage base, and higher taxes because of all the things that I've said. If it's part of some broader context where the tax structure changes, the calculus on this subject might change. But as a standalone subject, just to say we're going to raise the taxes on the private sector to help pay the bills and not going to change anything else, I think you'd get some opposition. And that's it for me. Thank you. Oops, it's not going to work. If it was my badge.
Well, good afternoon, and want to again thank NASI for having this very timely session on Social Security and its future, especially at this time of our fiscal debates as well. As mentioned, my name is Richard Fiesta with the Alliance for Retired Americans, and have been asked to speak about Social Security and from a worker and a retiree's perspective. So right now, we do face a lot of questions, as recently as CBO yesterday, on Social Security and its future. And today I want to talk a little bit about what the Bowles-Simpson proposal has on Social Security, or is offered for Social Security, and look at those proposals from an active worker and retiree perspective. I think it's important for us, from our organization and others like us, that Social Security in and of itself has been somehow morphed into a general deficit reduction ideology and in the deficit reduction debate over the last couple of years. On itself, it's a self-sustaining, self-funded program, as we all know, with all private sector dollars from either workers or their employers that pay for the administration of the system as well, and the people who work in the administration of the system as well. What that has to do with borrowing and deficits, another question, but looking at the system of itself over 75 years, it's been a worker-employer paid-for system. I want to talk a little bit now about three proposals in the Bowles-Simpson plan that are particularly troubling, I think, to both current workers and retirees. The change in the CPI, the change in the PIA, the primary insurance account, in other words, how your benefit is actually calculated, and proposed changes in the early and normal retirement ages as well. Bowles-Simpson proposed a COLA change that would create what's known as the chain CPI, rather than the current wage-based CPI, and it would take effect under their proposal almost immediately in 2012. Not even some of the most radical Social Security privatizers have proposed something that would affect current retirees, but Bowles-Simpson does. Even the most radical privatizers would say things like, we're not going to touch anybody over the age of 55, or if you're 55 or above, the system will stay in place for you. Changing the CPI to a chain CPI will immediately affect current retirees in a negative way. Actuaries have pointed out that immediately it'd be a 0.3% annual decrease in a COLA, and this, as we know, is a cohort that has not even had a COLA by calculation in the last 2 years. And over 10 years would be about a 3.7% reduction and a 6.5% reduction in 20 years. So these are very real proposed immediate changes to the CPI that affect current retirees and, of course, everyone else coming after them as well. The chain CPI apparently is based on substitution. If prices go up, you don't buy the brand name soup. You buy the house brand of soup, for example. But for seniors in particular and retirees, there isn't as much wiggle room in substitution. If your home heating oil goes up, for example, you can't just turn a switch in your house and all of a sudden your home is heated by natural gas, for example. Housing, again, an expensive cost for seniors. If you need a triple bypass, you can't go say, well, I'll just take the double today because it's a little cheaper. There are just certain medical costs, too, that are fixed as well. So a chain CPI will simply not work in a retirement context, and we're very worried about that, especially in its immediacy and its effect on current retirees as well. I think the most drastic proposal out of Simpson-Bowles is changing how people calculate the benefit, the PIAs it's called, your primary insurance benefit as well. Currently, there's a formula every year that for low-wage people, you get 90% right now for 2011 of $749, which is about $8,900 in income as your first tier, 90% of the first $749. Second tier is now, as we know, 32%, going all the way up to about $54,000 in income, and then a third tier at 15% from the $54,000 up to the current $106,800. What Bowles-Simpson would do is two bad things, in our opinion. It would add a new fourth category into the current 3 tiers, attacking middle-class workers and then later middle-class retirees, people earning $40,000, $50,000, $60,000 a year, and decrease their benefits upon retirement. And secondly, it would diminish overall retirement monies over their lifetimes as well. They've proposed the 90% keeping it the same. The 32% would go down to 30% for the second tier. They would add a new tier at around $37,000 to $40,000, somewhere in there, that is 10%. And then the current 15% for the high earners would go all the way down to 5%. So you would see a flattening of benefits, and the people taking the hit more than all are middle-income earners, current middle-income earners. And this would start even with people whose retirement age would be anybody born after 1962, according to the actuaries. So this would be, and start in the year 2017. This is not some far-off, multi-decade-out proposal, that reductions would start within 5 years and would start affecting anybody born in 1962 or afterwards, so that over a period of years, based on current dollars and the current formula, middle income recipients of Social Security or middle income wage earners in the retirement would see their benefits cut 30, 40+%. This, to us, is the most radical transformation proposal of the Social Security system, a flattening of retirement benefits, and really a fundamental transformation of a program that was designed to be a program to replace wages in retirement. Again, all under the guise of deficit reduction in spending, more of an ideological view than an actual what's wrong, how can we fix the program, how can we find that 2% of fix over the next 75 years as well. The third thing I wanted to talk about too is the retirement age and potential raising of the retirement age as well. I think we all know that most everybody knows that the early retirement age obviously now is 62, and nearly half of eligible beneficiaries claim benefits at age 62. And most recently during the recession, as predicted in down economic cycles, the number of people claiming at 62 or before their normal retirement age actually went up, and in some ways it's sort of a stabilizer to the economy, that more people who can't find jobs in that age range apply for Social Security. Unemployment rate will probably go down a little bit because of it. Actuarially, there's no harm to the system because benefits are based on the age that you claim them. So if you're claiming them early, over the lifetime, there should be no harm to payments or out of the trust fund as well. But Bowles-Simpson now proposes 2 things, maybe even 3. Raise the normal retirement age to 65, raise the early retirement age to 64, and then have some sort of quote-unquote hardship exemption for people in certain occupations, very ill-defined or undefined, that they somehow in certain occupations could get some sort of early benefits without penalty. Basically, these would be benefit cuts in all 3 situations, that if you raise the retirement age to 69, it's about a 13% benefit cut on top of what was a 13% benefit cut by raising it under the 1983 proposals when it went, as we're right in the middle now of raising the retirement age from 65 to 67. Secondly, raising the current early retirement age from 62 to 64, again, making people who in some cases physically can't work anymore, can't find work anymore. We could have a whole separate panel on age discrimination in older workers, especially in a down economy as we're in now. Simply puts 2 more years onto people potentially as well, and would also cut their benefits too. I think the most troubling thing is this kind of nebulous idea of hardship exemption as well. As anyone who's ever been involved in any kind of workers' comp claim, workers' comp hearings, or practiced or administered in that level, both at the state and local level or the 3 federal programs, plus what's currently happening in the SSDI program, the word delay is not a former congressman who's going to jail. It's actually a part of a system that slows workers who need their benefits down. That, you know, the SSDI program, as we all know, 2-3 years of just trying to get a hearing. State worker comp programs that have to also adjudicate, is this person disabled from the workplace and the like there too. I worked on a committee where we oversaw the federal black lung and FICA programs at one point in my career. Again, backlogs there at times when even there are statutory presumptions in the statute as well. Trying to take those types of concepts from workers' comp and put them into what should be a wage replacement program like Social Security, it just makes no sense, and the administration of such a program would be very, very difficult even to imagine, let alone try and design and implement on a national scale. You just can't see how that it could help people who may have had very difficult years in occupations. And then, well, you did this at age 18 to 22, but you sat behind a desk when you were 33, and et cetera, et cetera, et cetera. How do you even try and create some sort of system to adjudicate whether a person would be eligible without any kind of penalty for early retirement? So I think I want to end there, but saying that we are very worried about 3 things, some of which are immediate, change in CPI, one of which, changing the basic structure of the benefit, is short-term and long-term, a fundamental transformation of the system. And again, the retirement age, just because it's an easy thing to do, but for workers and retirees who actually go through a work life and need the benefit, it's not so easy for them. So I appreciate being here today, and thank you for the invitation.
I would also like to join my colleagues in thanking the National Academy of Social Insurance for yet another stellar gathering to talk about a program that is incredibly important for families across America and certainly for our nation. I speak to you today as an employer, a small business owner, certainly as one who works closely with representatives of communities of color across the country. I stand before you today as the daughter of 2 retired parents who took early Social Security, as the niece of aunts and uncles who are recipients of Social Security retirement benefits, as well as the recipient of Social Security disability benefits. I stand before you as the cousin of cousins who have received Social Security survivor benefits. Thank you. And so I can say credibly on all fronts that Social Security is an incredibly important program, not only for racial and ethnic minorities, but for the entire country. And I can also stand before you credibly and say that I don't think that, as an employer, that I actually think that Social Security is affordable. And I also think that entertaining revenue raisers for Social Security can be completely affordable as a future scenario for addressing Social Security's long-term solvency issues. So with that, I'd just like to lay down my marker in that respect. So, my comments today are going to be more high level. I'd like to have a conversation about what's going on in this country with regards to social insurance, particularly Social Security, what we've seen over the past 2 years, as well as where we're headed as a country, and why Social Security will continue to be relevant well into the very, very distant future, into the next century and the centuries after that. And so with that, we're not out of the woods. I know that a lot of advocates for Social Security had been very concerned that President Obama and his administration would be in cahoots with those who are actually opposed to the Social Security program by mentioning in his remarks of the State of the Union. I think that advocates put them duly on notice. Many organizations worked very hard to put the administration on notice that this would not be tolerated, and we saw that the President's remarks were in fact supportive of strengthening Social Security, which was encouraging. But over the past 2 years, we had not seen that much encouragement because indeed the administration, the dominant narrative about deficits causing Social Security had been encouraged by the administration by the very fact that we had what respectably this morning I saw was called the Simpson-Bowles plan, and today Richard mentioned the Bowles-Simpson plan. I've also seen it referred to as the BS plan, and of course it's also been called the Cat Food Commission because what it would do to people if implemented, their inability to afford food. So with that, the fact that there has been, a complicit kind of alliance between the administration and those who would see or who would argue that Social Security is somehow aligned with causing deficits. And so there has been a lot of angst caused by that, and certainly a lot of angst about whether or not the White House would continue to look for conservative credentials, particularly in the re-election for 2012, by somehow further aligning themselves with that effort. And so we're seeing a backtracking, which is good. However, there are likely dangers. What we have seen over the past 2 years is that informal efforts around Social Security, particularly social insurance and Social Security in particular, that Social Security advocates and experts have been frozen out of processes. We have been frozen out of processes. Now, just to relate a quick story, in the very beginning of the administration, we actually saw the creation of we had a summit at the White House on deficit reduction. And in the Social Security breakout, there were a number of comments that were made by Heidi and others and myself with regards to the vulnerability of women and racial and ethnic minorities. And in the remarks that were released publicly, these comments were actually scrubbed from the record. I actually, when I saw that, I actually reached out and wrote a formal letter saying that this, of course, was an abomination. In the next version, I did see that the remarks were added back. Some remarks were added back to the record, but that was an early indication that that there was a certain positioning going on. But when the creation of the Bowles-Simpson plan actually came to being, we actually saw that there wasn't a significant representation of people who are supportive of strengthening Social Security on that particular commission, and it was appointed by a Democratic president. So certainly the issue of inclusion, and when I mean ideological inclusion, needs to be something that we continually place at the forefront of our activities going forward. And it needs to be something that we pressure the administration on making sure that they do, and certainly the Congress. There has been an expressed desire to do something on solvency. I don't know if the administration is going to try to do something on solvency if they are actually reelected, but certainly that has been indicated, a desire has been indicated, and if that's the case, definitely representation of all people should be a part of that. The payroll tax holiday is of concern, right? Certainly, we know that there might be pressures in 2012 not to, to continue the holiday. And we know that this has an impact on Social Security revenues, and it certainly has an impact on the projected date for long-term solvency. So we need to make sure that there are that the White House is held to their word in terms of the short-term payroll tax holiday, and that there are no political pressures to continue it beyond the next 2 years. And then I'd like to speak briefly on the dangers of raising the retirement age. And in addition to the very real dangers that Richard outlined earlier, there is a danger also, I think, in terms of racial and ethnic disparities. And in class disparities, because we know that people who do not live as long tend to be people of color. They tend to be people who are very low income. And certainly the effects of raising the retirement age would disproportionately burden these populations. And in some respects, It represents a subsidy for people, a subsidy that takes Social Security wealth from those who do not live as long and gives it to those Social Security wealth for those who have longer lives. While this is certainly how Social Security works in general, we shouldn't be looking to actually aggravate those kinds of disparate effects of the program. The hardship exemption, as Richard mentioned, is certainly not credible. I would argue that it would simply become a way to control program costs by managing people who have access to early retirement. So the BS proposal to raise the retirement age, both the early retirement age and the normal retirement age, is simply untenable from the perspective of communities of color. Now, I would also like to talk about the impact and continued need for Social Security. The recession has had a bad impact on everybody. It's been just incredibly terrible for the nation. But when you actually look at the numbers, whether any metric you want to pick, if we're looking at unemployment figures, if we're looking at who's disproportionately undergoing foreclosures, certainly if we're looking at income, we know that it's the people of color, racial and ethnic minorities, Latinos, African Americans, Natives, Asian Americans have been hard hit by the recession. Their numbers are higher across the board. In all of these respects, they were more likely to be offered the home loans that exploded. They're more likely to be going through foreclosure and losing their home ownership equity. Certainly, these were also the communities that have a higher rate of loss of pension coverage. We know from the data that from 1979 to 2006, African American private sector workers saw their pension coverage decline from 45.8% to 37.5%. Latino private sector workers saw theirs decline from 38.2% to 22.6%. And white workers also saw a decline, but it was from 52.2% to 48.5%. So we already had structural issues with regards to racial and ethnic disparities, and these are exacerbated by wealth disparities. Before the recession, Federal Reserve data actually tells us that people of color had significant wealth disparities with, for every $1 in wealth owned by white families, Latino families only had 12 cents, and African American families only had a dime. So we know that wealth, assets, and income are a challenge for people who are not retired. And that means that their projections for retirement in the future puts Social Security front and center. They're going to have a heavier reliance, even heavier than I think we're seeing now, on Social Security as a result of the effects of certainly the financial crisis, certainly the housing crisis, and the economic recession. So why is this also important? It's also important because we're actually seeing a massive shift in the demographics of this nation. We've got the Latino age wave that's coming along. And with that, we're going to see a significant shift by the year 2041. The Census Bureau actually projects that the country will become predominantly racial and ethnic minority, predominantly people of color. And so with that, Social Security absolutely must be strengthened. These are the communities that have the least right now, and by all respects, they will continue to have the least. And Social Security will be very, very important to these populations. So with that, all of these conversations that we're having, and I don't know what planet the folks who are on the other side of this issue come from, but certainly, families are desperately reliant on these benefits. And if Social Security were to be cut drastically, or if it were to go away, we would actually be in an untenable situation in a country that none of you would want to live in. And so with that, we have to recognize the value of Social Security and continue to place it front and center in our advocacy efforts. Thank you.
Good afternoon. I have a couple of questions for you. So if you're in the corners and thinking maybe you can snooze a little bit, this is the time you got to sit up. Who in this room received survivor benefits? Anybody? And you can stand, yeah, that way, because actually that's even better, because then you get to stand up. Who in this room knows somebody who receives survivor's benefit? Okay. Who in this room knows somebody who went to college on the student benefit? Who's in this room because they're just waiting for this panel to be over so they can go to the reception? Honest people. I want to start with a story, and it's a story about a young man. He was just 16 between his sophomore and junior years in high school when his father died. His father's death provided him with Social Security benefits until he was his 18th birthday. He saved those benefits and used them to put himself through college at Miami University of Ohio. He graduated in 1992 with a degree in economics and political science. Within months of his father's death, his maternal grandmother came to live with the family. She had Alzheimer's. And it fell on him, as a teenager, to oftentimes help take care of her. So he'd brush her hair, he'd braid her hair. And what he learned, what he credits his father's death and taking care of his grandmother with, is teaching him firsthand how important social service programs and Social Security were. He went on to become a very successful career and a member of Congress. A Social Security safety net success story. So why now does Paul Ryan want to dismantle the program that helped him and his family? But Paul Ryan knows firsthand is that Social Security is not a retirement program, it's a family support program. And it's up to all of us to remind him of the role it played in his success and in his family's success. In fact, Social Security is a safety net for about 98% of our children in America. In 2005, 6.5 million children lived in families who received part of their income from Social Security. And that's very important in today's economic times, where the fastest growth in family structure is multi-generational households. Families are coming back together, whether it's because of foreclosure, job loss, need to retrain, need to pool resources. So when you think about a family's income, it plays an even more important role now. In fact, it lifts more children out of poverty than any other federal program, next to the Earned Income Tax Credit. And when it comes to grandparents raising grandchildren, or grandfamilies, which are a very important family to us at Generations United, one that we advocate and work with quite a bit, when it comes to grandfamilies, 22% of them currently live in poverty. If it wasn't for Social Security, that number would be closer to 60%. So it plays a very, very important role in supporting families. There's more details on that on the fact sheets that we've created that are up on our website at gu.org. So it's really a family support program, and we've been encouraging the White House, because if you go on their website, what you'll see when it comes to Social Security, unless they changed it in the last couple of weeks because we keep reminding them, is it says Social Security and seniors. It doesn't talk about Social Security and families. It doesn't talk about that important aspect of the program. And that is part of the conversation that we really need to help shift. So we have to shift the conversation, but we also need to look at how it is that we can strengthen the program for children and families, which is a very, very important element. And there are two areas that at Generations United, and I know many of our colleagues in the room are paying attention to and really want to work on. And the first one of those is restoring the student benefit. Because as many of you know, as a part of the changes in the 80s, the student benefit was eliminated. And before then, up until age 22, as long as you were in college, you continued to get survivor's benefits. And what we know now, thanks to a NASI report that Alex Hurdle-Fernandez, where are you in here, Alex? Yay, Alex did. A wonderful report if you haven't seen it. What we know is that about a third of the people who would have enrolled in college didn't, because they needed to go to work. They couldn't afford to go to college. And as our president says, we need to educate our way to a better economy. And one of the ways that we're going to educate our way to a better economy is to make sure that these young people have the opportunity that they deserve. If we restored the student benefit, the earnings that a college graduate would make compared to somebody who didn't go to college would basically offset the cost, the small cost that that would incur. The second way that we're looking at ways that need to really strengthen the program for families is when it comes to grandfamilies, to grandparents and other relatives raising children. And we're looking at and very interested in working with people who are interested in looking at what the family cap means to those families, how the grandchild benefit could be strengthened, and caregiver credits, because of the people who take time off to care for children so they don't go into the foster care system, or take time off to care for a relative so that they don't have to either go into an institution or incur the costs that they would have to if that family member wasn't there. In our report that we have on our website called Family Matters, Public Policy and the Interdependence of the Generations, we've sort of outlined a little bit more about those topics. So what have we done to try to educate people about this? It's really amazing. It's an uphill battle that people oftentimes still all think about Social Security as a retirement program. They don't think about the important role it plays in family and in family support. So it's this uphill battle. But a part of what we're trying to do is get the message out so that people understand how it protects children and families. We need to educate and engage unlikely allies and give voices to people who can talk about what it meant to their families, what it meant to them as children. And one of the ways that we've worked towards that is that we organized the first Social Security call-in day for all generations. It took place the day after Grandparents' Day in September this year. And it was sponsored not by the usual suspects, but it was sponsored by the Child Welfare League of America, the Children's Defense Fund, Voices for America's Children, AARP, Easter Seals, Grand Families of America, the National Committee on Grandparents for Children's Rights, and the North American Council for Adoptable Children. And the message was strengthen Social Security for all generations. We did a couple webinars to help prepare people, because people still really don't understand, even though they're children's advocates, what it means for those children. So we did some webinars. We were able to generate about 4,600 direct calls and about 55,000 Facebooks, tweets, and all that Twitter stuff that goes on with that message of how important Social Security is to children and youth. We've also been working to identify members of Congress, such as Congressman Ryan, who benefited from Social Security's benefits or who have somebody in their family who did. And so far we've recognized or identified about 18 members of Congress who we're working to meet with and talk with about what that experience has meant. And we've identified another 10 who are interested in carrying this message forward. And if you're interested in that, I'm really delighted to introduce one of my colleagues who's in the room, Shelton Rulak. Shelton is our policy analyst at Generations United, and be sure and talk to Shelton if you're interested in knowing more about that. But I think that being able to get those voices and those champions on Capitol Hill are really important. The other thing that we've been doing is that we try to not let people get away with it when they try to frame Social Security as only a retirement program. And so we've done that through letters to the editor, through comments, through blogs, through various ways. And we've been successful so far in getting letters in the New York Times, the Washington Post. And where I'm really excited that we've started to make some progress is through the youth media, like youth radio, some of the youth blogs. And we've been able to start to engage some of the youth journalists in talking about these issues and why it's important to them and to their peers. So the media response, the rapid response is what we're trying to make sure we get out there. Now, what do we hope that we're going to be able to do in the future is that we're developing a Social Security for All Generations sign-on letter that we're asking a lot of the youth and family groups to sign on to that will be distributed to policymakers. And we're also planning on holding a briefing on Capitol Hill on March 3rd, which if you're in Washington, we hope that you'll join us. It's going to be March 3rd from 2 to 3. We'll have some of the stories that we've been able to identify, some people speaking as well as some experts that will be speaking there. And we'll be releasing a new publication on profiles of people who have benefited and been successful because of the program's existence. The other area, of course, is continuing to monitor the media and working to place particular information about the importance of Social Security. And I'm really delighted that we're in the process right now of working with Virginia Reno and NASI on an op-ed that we'll be placing soon. So we're going to continue to educate, we're going to continue to engage, we're going to plan another call-in day in 2011, which I hope that many of you will consider being a part of as well, because it is that important message that it means something to people of all generations. It really goes to one of our mottos at Generations United, which is, it's not a fight, it's a family. And too many people are trying to hide behind grandchildren and trying to say that we need to save this, do this because of our grandchildren, when in fact what we're talking about is something that's going to hurt future generations. It's as one grandmother said during one of our briefings, Social Security benefits made the critical difference in my ability to support my grandson rather than leave him to be raised by others. It's a vital, critical program. And remember, it's a safety net. It's a safety net we need to strengthen, and it's not a hammock, as some people would like you to believe. It's not a hammock, it's a safety net. It's an honor to be here today, to be with my fellow panelists, and to be a part of another wonderful NASI gathering. So thank you.
Thank you all very much. Very insightful and very interestingly unique and different perspectives. Now you know the drill. If you have a question, please come up to one of the microphones and we'll be happy to take them. We already have a taker. Yes.
Thank you. My name is Susan Prokop, and I'm with Paralyzed Veterans of America. And for those who are wondering, what's a Veterans Service Organization representative doing here? Military service has been covered by Social Security since 1957, so members of the military do pay into Social Security and earn their rights to those benefits, just the same as private sector folks. But also, over half of at least PVA's membership was injured outside the military, and as a result relies solely on Social Security disability insurance if they are not employed. And that's one of the things I wanted to express a little disappointment to NASI about this panel. The title is Views from the Stakeholders of OASDI, Employers, Workers, and Vulnerable Communities, and lovely folks up there at the table, but you did not include anyone from that latter piece of the OASDI program, and I think it would have been informative to the broader audience to hear about the importance to people with disabilities of Social Security, and would encourage you to think about that for future conferences. One of the panelists, I believe it was Mr. Porter, talked about need for system-wide solutions, and one of the struggles for people with DI, SSDI, is the work disincentives within the system. And I think your principle about more workers need to stay employed, I'd be eager to hear what the employer community feels about working with Social Security to promote employment of people with disabilities, particularly those who are on SSDI, to enable them to either go to work or remain employed so that they don't have to rely as much on Social Security and can pay Social Security taxes and retire at whatever normal retirement age they may so choose. Thank you.
I applaud your question. And I don't know that I could speak for all employers on this, but I will speak on behalf of my son-in-law, who is a quadriplegic and is full-time employed as a financial advisor with a major Wall Street bank. Put himself through school, was a recipient of Social Security and Medicaid benefits all the way through school, and when he had the audacity to try to get a job and support himself, of course the government instantly cut off all his medical benefits as a quadriplegic. He had to find an employer who was willing to support him, and his first year out-of-pocket expenses exceeded his first year's salary. Now, that's wrong. And I know that story is repeated over and over among the disabled veterans. And my personal view, and I'm showing my bias as not necessarily representing employers, but I think it is system-wide. I think the fact that we have a Social Security system that discourages people from getting work, we have a Medicare, Medicaid system that discourages people from getting to work. You're on Medicaid and you go to work, you lose your benefits instantly. There ought to be some way that we can change the system to allow those who are disabled to be productive. Fortunately, my son-in-law was able to find a company that would be willing to work for him, and it's been a highly successful engagement for both he and his employer. But that doesn't happen routinely. He was fortunate that, in spite of being a total quadriplegic, no use of his arms or his legs, he was able to put him go through school and get his MBA and get a really, really good job. We need to support people who have disabilities, who have the capability of doing gainful employment, to get them into the system and get them employed, and that's my commercial. I'll let the employers speak for themselves.
Yes.
Yes, hi, Daniel Marins from Social Security Works. My question is also for Mr. Porter. About your sort of the demographic presentation that you were making, I guess fundamentally the worker to retiree ratio, since all the workers had been grandfathered into the program in the 50s, really hasn't changed that much, maybe from 3 to 1 to now approaching 2 to 1, and so I don't really consider that a demographic crisis, and the actuaries do say it'll stabilize with the birth rate at about 2035. Secondly, related to the retirement age question, from an economic perspective, it's been argued specifically by James Galbraith, but also I think people with the program's founding, that in fact allowing workers to retire perhaps even at an earlier age than they absolutely need to can free up space in the labor market for people entering it, rather than have employers be forced to hire a net larger amount of people, which would be ideal. But and so I wonder whether that is a factor in the economic calculations of employers.
I think in response that the absolute ideal is to have an environment where employers are generating new jobs. And you wouldn't have to make that choice. The older workers could continue to work gainfully, and the younger people would have positions. One of the things that we heard about Germany earlier, my observation in Germany is that after the Berlin Wall came down, there were a huge number of workers from the East who were relatively unskilled. They're all retiring and leaving room so that the young people have plenty of positions, because there was this huge group of people who didn't have the skills that the West had. It's a completely demographic different from what we have in the United States. We have a situation where it's cheaper to do production elsewhere. It's difficult. We just overall need a structural change that encourages new job creation in the United States, because I don't think we should have to make that decision. Now, if it comes down to whether you replace somebody with a younger worker versus an older worker, as a social policy, somebody else is going to have to decide whether that's the right social thing. Is the education level the same for the older worker, the younger worker? Is the requirements of the job, have they changed? If the older worker is doing manual labor and the new job is automated with computers and you need somebody who can do that, are those jobs fungible? I think those are huge questions that go far beyond what I was talking about. I'm looking fundamentally at the numbers. It's inconceivable to me that a 65-year-old today isn't considerably healthier on average than a 65-year-old in 1975. It's inconceivable that most people couldn't continue to work a little longer than him. I grant you there are people who are disabled who can. I grant you there are people who for various reasons can't. And I'm not saying disenfranchise them, but it's just inconceivable to me when I look at the health of people who are living now on average into their 80s and 90s, to say that they aren't better equipped to work today than they were in the 70s, I just don't get it.
The one thing I would say is that the full age is 66 and approaching 67 rather than 65. But
Well, yeah, okay.
I'd just like to actually challenge that in the sense that, generally we have seen an increase in life expectancy overall. But actually, if you look at subpopulations, that is actually not the case. In fact, we've seen some subpopulations, particularly those pockets of poverty, particularly certain regions of the country, where we're actually seeing a slight decline in life expectancy. And I would also argue, because I work in the public health sector, specifically on childhood obesity issues, that we're actually seeing a generation of young people who are expected by many projections to possibly live sicker and shorter lives than their parents because of poor health very early on, and what it leads to adult chronic diseases. So you've actually got public health epidemiologists who are projecting a very different scenario for our future, not a continued increase in longevity upward as we have been claiming, but a stagnation in longevity.
Thank you very much. I'm sorry, we're going to move to this side, I believe that, okay? Yes.
Thank you. My name is John Burbank. I'm with the Economic Opportunity Institute, which is in Seattle, Washington, sort of on the falling off the West Coast, but we still can't see Russia from where we are, but we try. So I appreciate what Donna did in terms of the hand show of people who were survivors, got survivors benefits, or knew someone who has survivors benefits. One of the things we do at the Economic Opportunities Institute, we're an advocacy and a policy institute, and whenever we have meetings on Social Security, we start them off by saying, well, how many people here have either benefited directly from Social Security or have an immediate family member who benefits from Social Security? And so, actually, I'd be curious, how many people here have benefited from Social Security or have an immediate family member who has benefited from Social Security? Okay, well, that's actually a poor amount that you usually get. You usually get about 95 or 100%. But the point about that is that that's sort of why Social Security is under attack, because it is a fundamental foundation of our democracy. And we've had 30 years not of fact-based attack on Social Security, but 30 years of ideological attack on Social Security, which is one of the reasons why we're here. We're discussing the supposed fiscal crisis of Social Security, but if you accept the Social Security trustees' medium range report, you realize that in 2037, when we're only able to pay 78% of benefits, that still means that the typical retiree will get about $1,800 more in that year than the typical retiree gets now, and that's in constant dollars. So it's not really a crisis in that respect. What's the crisis is that we have had incredible loss of value in 401k programs and a volatility in those programs, and employers have shifted from defined benefit to defined compensation programs, shifting responsibility from employers to employees. At the same time, the defined benefit programs have been underfunded, and at the same time, people have lost their retirement savings. So that's the real fiscal crisis. So when you think about that, and you think about the people who are approaching retirement, then it might make more sense to try to shift the conversation, to begin talking about, well, how can we then, this is a time when we should actually be increasing Social Security benefits, not talking about diminishing those benefits. So one of the things that's happened in the past few years is that we've had this tremendous shift of national income from labor to capital. That's one thing. And another shift within compensation from middle wage and low wage workers to the very highest wage workers, who, as you know, those wages are not taxed for Social Security. So my question and my idea is to ask you, what happens if we just remove the cap, the payroll cap on Social Security, and at the same time go back to the way it was about 10 years ago, make sure that we have full benefits at age 65 and increase and have student benefits as well? Thank you.
Okay. Is there a specific question for anyone, or?
I want to know what happens. I would like your opinion on that idea.
Any one person, if you'd like to respond, and then we'll move on to the next one.
Well, like anything else, costs do go up and incomes do go up. And as we've seen over the last 20 to 30 years, incomes have risen much more highly in the upper strata of the workforce rather than the lower strata. So rather than having what was sort of a informal, not statutory benchmark of Social Security covering 90% of all wages in America, we're now down to about 82%. I mean, just like we raise minimum wage as things go up as well, just restoring that to 90%, not even blowing the cap, would solve what, about a third, 35% of the long-term funding gap. Another, we think, very easy, low-hanging fruit thing to pick is that these cafeteria plans, HSA, FSA, those plans are not subject to FICA taxes. Treat them like 401ks, like DC plans. Subject them to FICA taxes, like your 401k contributions are, but not exempt them from FICA taxes. And this really hurts middle-class workers under the situation now that if you're, let's say, a worker making $40,000 to $60,000 and your employer only offers a high-cost plan or an HSA, FSA plan, you have to take $3,000, $4,000, $5,000, whatever $1,000 out of your income, put it into that, and then those wages or salary is not helping you in your Social Security retirement. So compound that over 20 or 30 years if you're in that situation as well. So for us, those are two very simple things we could start off with.
Thank you. Yes.
Hi, Kalman Rob. I'm an economist at the Social Security Administration, and I just would like to comment on a comment/question of the person speaking before me from this microphone, of expressing a really strong disagreement with the idea that encouraging people to retire earlier would somehow be a good method of creating jobs for younger people. From all of the literature I have seen, that sort of approach is really not an effective way of creating new jobs or contributing to the growth of the economy. There are real questions with increasing the retirement age, but those have more to do with tremendous heterogeneity in the health status of people as they approach the retirement age, which has been alluded to at earlier sections. Thank you.
I applaud you on that. I've spent quite a bit of time in my career looking at the economics of early retirement incentives, which is effective that what it'd be is incenting somebody to retire early to get the job for somebody else. And typically those are incremental cost events. They do not save money. They actually cost more for the employer to do than keeping the employee on and letting them work more. So I agree with you violently, I think.
Sure.
I think that part of what you're talking about is I think we really need to be rethinking work period in terms of the flexibility that we provide as people are entering and exiting the workforce. As the lifespan has increased, we really haven't done a lot except try to sort of create, I think, a whole gerontological field, and that a part of what we need to do is really to reframe how we look at aging and what the opportunities are as people age and what the expectations are, because we all know that in the 60s, Del Webb was able to sell this whole idea of Sun City, and it's a time out, and you could stand around in the swimming pool, you could play bingo, you could do this kind of thing. We can't do that for 30 years. And so it's what are our expectations and what are the opportunities? Because we don't allow people to give back in ways that they could if we had those bridges, if we had those vehicles.
Thank you. Yes.
Hi. Janice Gregory with the National Academy of Social Insurance. This goes to my friend Ken as well as to others who would like to comment. And much in the conversation we've just been having, a lot of times when we think about retirement age, we think about it increasing it, which is sort of a stick. But I want to set that aside and pick up more on what Donna was just talking about, which is the opportunity in working longer. And Ken, your analysis of if 5 million people worked longer, the per capita cost going down, which I think is very instructive. But my question goes to this. What do you see as, setting aside the current recession, let's go to a normal economy. In a normal economy, what would you think would be primary things that we could think about either in the social insurance area or in the job retraining area that would make it more inviting and more economic, obviously, for employers to seek out, hire, keep older workers? Do we make Medicare primary? Do we, as opposed to the employer plan? You know, what are the kind, do you have things that you could throw on the table that would be worth chewing on?
I think because a lot of employees retire before they're Medicare eligible, that by itself is probably not the solution. What I see and what I've heard a lot of employees say is they really wish they had the opportunity to phase into retirement. And that's easier said than done. If you're in a professional environment, pretty easy to have somebody go down to 4 days a week instead of 5 days a week. And if you have 20 professionals and you have 5 people going on to phased retirement, you can hire another professional and get the same number of hours, and these individuals are still gainfully employed, but they get a little more free time. People love their free time. They like it, but I don't think most people really want to just go cold turkey, and if they think about it, they're hired at 20, retire at 60, and are going to live till they're 85. For some of these people, they're going to be retired for more years than they're employed, and that's a scary thought. People want to be productive. They want to do something, and it's more difficult to go into a phased retirement environment when you're in production facilities, because you've got schedules that might be 12-hour shifts or whatever it is, with the demand of the particular facility. But I think from a social perspective, finding ways of revamping our policies to make it acceptable and encouraging companies to find ways to create part-time or phased down employment periods so that people who are approaching retirement ages would have the opportunity to continue working gainfully, would get a little bit more time off in some way. I think that would go a long way to helping.
Yes, thank you.
Anna Rappaport, actuary, Anna Rappaport consultant, and phased retiree. And I want to actually follow up on Ken's last comment and Donna's comment. Do you have any ideas for the innovations that might, in fact, facilitate creating different work options and phased retirement options?
To some extent, if you're dealing with production facilities, you've got to, you really need to get the engineers involved and say, how could they rethink and retool the production facilities to enable that kind of an environment? But from a policy perspective, a lot of our laws around discrimination and that sort of thing, from a pay discrimination perspective or plan discrimination, participation discrimination, tend to discourage part-time employment, because keeping track of who, if you treat part-time as a benefit, well, who is benefiting them? Is there a disproportionate number of highly compensated getting in? And I don't know, but the record keeping, I've tried to investigate what the record keeping requirement would be to make sure that you're complying with all the rules, and it's pretty daunting. So we need to think about the rules and the structure of the rules. Is there something that needs to be done to make it easier for employers to create the phased retirement opportunities.
I think one of
Yes.
the...
I'm sorry.
Oh, I'm sorry.
Sorry, you go ahead.
I think one of the interesting experiments that's underway right now is Dr. Jack Rowe is working, doing a sabbatical at Stanford right now, and he's been working with one of the county governments there to develop a plan for county workers to encourage them to phase out or move on and into other occupations or other opportunities. And so what they're looking at is providing the opportunity for county workers to volunteer 1 day a week in the local schools and compensating them for that day that they'll be working in the local school and get them engaged with the districts and start to move in that way. And we don't know how that's going to work, but I think some of those kind of cooperative arrangements and experimentation between employers and whether it's government or private sector and how we can encourage people and help people as they're bridging, whether it's, again, bridging to retirement, to and from caregiving, and to and from the workforce are important.
Great, thank you. I see we have about 10 minutes left, so I'm going to ask that we make these questions pretty brief so we can get everyone in. You have 3 people standing.
I'm a
Yes.
lawyer. I can't make it brief. I'm Paul Nathanson. I'm the director of the National Senior Citizens Law Center. And my question or comment relates to the fact of I haven't heard any discussion about the role of the courts, the other branch of government, in public policy. For example, there are court cases going on right now with respect to health care and health care reform that may well undercut, in terms of this Supreme Court, the entire social safety network and the work of the New Deal. So the courts have a major role. In the area of age discrimination, basically the court, through the Gross decision, we call it the Gross decision, has basically done away with any right to bring an age discrimination in employment case. You can pass wonderful statutes and regulations, and unless they are enforced, unless they are really administered at the grassroots level, it doesn't mean anything. And so a separate issue that we're concerned with, and I think it's really important to remember that, you can win a case in the U.S. Supreme Court, and that's a court issue, but unless the bureaucracy actually implements it, it doesn't mean very much. I mean, so that there's almost an illusory non-disability appeals process in Social Security, which disproportionately impacts people under, I know we don't talk about SSI in a Social Security meeting, although I happen to care about SSI recipients. Anyway, that's it. My question is, where do you see the role of the courts in terms of the big social policy question, which I really think is a major threat to the New Deal? And in addition, the kinds of litigation and cases that are going on now.
Thank you. Anyone?
I think you laid it out quite clearly. And it is important, and we're glad that you're on the front lines. And to the extent that we can be engaged to join you where it's appropriate and feasible.
I would add that every time I read a legal brief, I wonder why it's called that. But I would ask back to you, if we get into a situation where employers are providing opportunities for phased retirement and they have significant numbers of people who are over the age of 45 working less than full time, is that going to be interpreted by the courts as age discrimination because you're not employing them full time? And how do you fix that?
Okay. Yes.
Thanks. Hello, my name is Nicole Wu, and I'm from the Center for Economic and Policy Research. I'm going to start with a contribution to the conversation and then a question. The contribution is that we have some papers in the exhibit room. One is about how many of the jobs held by workers over the age of 55 are in physically demanding or physically difficult jobs, so I encourage you to look at that. And with life expectancies, we have another paper that shows that most of this average life expectancy that we all hear about is mostly due to increases in childhood survival and, to a certain extent, increases in life expectancy during working years. And we actually do a breakout where we see that once people make it to 65, when you compare people who were 65, 50 years ago versus now, the life expectancy increases have been very small, about 5 years for men and less than a little bit over 3 years for women, I believe. So when we talk about increasing the retirement age, we have to think about whether or not we're talking about, childhood diseases going away, causing it to look like life expectancies have gone up a lot, or whether we are looking at people once they get to 65 and what their life expectancy is like from that point onwards. We're also finding that because people are surviving in their working years, that years of work have actually increased. Workers today are working more years than workers 50 years ago, and workers born now will be working more years than people now. And again, that has to do with these expanded lives. And then my question actually is for Mr. Porter. I have to say I show so much admiration for your son-in-law. I think as a father-in-law, you understand how people can fall into this hole between Medicaid and employer health care. And then as an employer, we know that health insurance costs are a huge competitive disadvantage compared to other developed nations' employers. So this is shifting into tomorrow's discussion, but I just wanted to know if you could give us a perspective on why more employers don't support things like universal single-payer health care. It seems like that would help employers and help people like your son. So if you could give us a quick opinion on that.
I think people like my son-in-law would have difficulty even in countries with universal health care. The systems just aren't, they expect that because you have a disability that you're not intelligent. That's my political commentary. I would like to comment on the mortality tables briefly. I think the Society of Actuaries table is looking at annuitized population, people who are actually receiving annuities, so that would be the older population, would indicate that there's been a rather significant increase in life expectancy. And I know in my prior employment where I had a very large population, we saw significant increases in the life expectancy of people once they reach the age of 60, taking out all the effects of prior years. So it may be that there's different in the broader population, but certainly in those who are collecting annuities, there seems to be a significant increase in the life expectancy. So that's just a different way of looking at the topics.
Those who are able to afford annuities tend to be high-earning, white-collar individuals. And certainly that's not, the entire population.
And now I want to go back and answer your other question, which was why are employers in favor of a universal system? Actually, employers have been on the forefront of trying to get health reform significantly for a number of years. There is a big difference between the United States and other countries with universal systems, and part of our issues deal around the way we have become in our tort system, in the way we demand health care right away. If you have a need for an MRI, you want it today. I have a friend of mine in Spain. I said, well, if you have a major injury and need an MRI on your spine, what is a reasonable length of time to wait? And he said, well, we should get to the specialist and the MRI within 5 to 7 days. That's acceptable in that society. It's not acceptable in the United States. We have a lot of redundant health care in the United States so that we have people at the ready for those who have the coverage to get instantaneous results. That is added to our costs. And simply perpetuating that in a national situation simply takes a very costly system, an inefficient system, and nationalizes it. The reforms that employers would like to see tend to be ones that would fundamentally improve the system, and whether it's done through a national program or through a private system is less important than getting the fundamental reform so that it's efficient.
And real briefly?
Yeah, so as an employer whose costs have gone up dramatically in health care from $18,000 to $24,000 in 1 year, I am absolutely in favor of universal, truly universal health care. Earlier, Mr. Porter actually mentioned that companies that are operating globally are at a competitive disadvantage because of their human resource costs, particularly their healthcare costs. And so it makes all the sense in the world for employers to get out from under the burden of having to carry those costs by supporting a plan that could be more efficient in a universalized context. In fact, I'm thinking Medicare for all. And I would argue that something that was structured like that is likely to be more efficient than the current system that we currently have. If we look at the efficiencies of how Social Security is administered, for example, we know that the administrative costs of the program are highly efficient. And that if we get rid of the redundancies in the current healthcare system, and if we also address and take out the profit motive from the entire enterprise, that we're likely to get more efficiencies of scale and certainly to get more effective in operating healthcare structure in the future, which would help employers like myself. Thank you.
And just as someone who's lucky enough to have health insurance, I don't know when the last time I got to see a specialist in 5 to 7 days, so I'm ready to move to Spain. But yes, our last question.
Ken Buffin, independent consultant and actuary. I have a question addressed to Ken Porter. Ken, in one of your parts of your presentation, you referred to social policy needs, and you established a call for a comprehensive national retirement income policy. I wonder if I could just ask you briefly in the remaining couple of minutes to elaborate on what you would see as the particular objectives and what recommendations might come out of such a national policy. And then very specifically, in light of the decline in the defined benefit retirement system, the failure to deliver adequate benefits, although certainly there are many fine companies that do succeed still in providing adequate benefits, the uncertainty associated with the defined contribution system. Is there a rationale for substantially extending the scope of Social Security and lessening the reliance on the private sector?
Very good questions. Before the Pension Protection Act was enacted, and before it was actually proposed in Congress, I went to several leaders of Congress and urged them to establish a commission that would, in fact, define a cogent national retirement income policy. It's my belief, and it continues to be my belief, that our failure to have a policy has contributed to the mishmash of rules that we have. I don't believe personally that we would have adopted a highly volatile funding regime for pensions that helped kill pension plan, defined benefit pension plans, if we'd had a policy that we said our policy is to encourage retirement income. We didn't, you know, I testified before a hearing in the Senate on Social Security, and they said, well, what's the, you know, what is the three-legged stool of private pensions and Social Security and savings? And I said, well, really, there never was a three-legged stool. It was a two-legged stool that happened to look like three. One was retirement income, and the other is retirement savings. And there's a source of retirement income, and at the time, it was Social Security and defined benefit plans. And savings was, whether it was 401k or whatever else, but really the balance ought to be between what is appropriate amount of income and appropriate amount of savings. And there ought to be some policy around what is a meaningful level of income that ought to be the goal for people in retirement. Whether it's solved through Social Security or a private system is secondary. The important thing is saying, what is our policy? What do we want as a nation to have our seniors living on when they get to those ages? Do we want them to have income? And if we want them to have income, we ought to have a policy that says so. And then we ought to look at all of our laws and all of our regulations and rethink them in light of what that policy is and say, do these laws and regulations contribute to the success of that policy, or do they detract from it?
All right. Well, we see Ben standing here, so we know what that means. Please join me in thanking our very knowledgeable panel. Before you leave, I do have a couple of quick announcements. First, we are really fortunate to be joined here all the way from Tokyo, Japan, Professor Takayama, who is the director of the JRI Pension Research Center project on intergenerational equity. You can meet him this evening. His book is available in our NASI exhibit room. It's entitled Priority Challenges in Pension Administration, provided as a courtesy from Stanford G. Ross. So welcome, Professor Takayama. And lastly, just to remind you, we have our John Hines Dissertation Award that will be going on next, the reception for that. And as well, our dinner will start at 7, followed by a performance from the Capitol Steps.